Thank you very much. We are now joining the live webcast of the Global Forum on Interprofessional Health Education. Welcome to our webcast viewers. You will see people milling around in the room because we have just concluded a 45-minute session of a World Cafe. The World Cafe's objectives were to stimulate discussion and critical thinking, as well as to model one of the weaknesses in the healthcare system, which is episodic encounters without continuous care. My name is Sarita Verma, and I am the co-lead for the Canadian Collaborative and a member of the Global Forum. Seated in the room, you'll see several tables of folks who are members of the Global Forum, as well as our guests and our speakers on the side of the room. This webcast that you are now joining is the conclusion of the World Cafe, at which 7 questions were posed at 7 separate tables, and individuals moved from table to table and were given 5 minutes to, actually 4 minutes, to discuss a very complex question and to then come up with some challenges and some solutions in response to that question. In the Lancet Commission, one of the key weaknesses that was identified in fact, education linked to practice, and indeed related to interprofessional care, was that our health system experiences multiple episodic encounters without continuity of care and continuous care from multiple providers. And the opportunities for those providers to actually interdigitate and interrelate with each other is one of the biggest challenges we have. To take this the next step, we have 7 of our facilitators who I will ask to introduce their question that they posed to a very well-behaved and very compliant, that's the word I was looking for, group of members who generally tend to be fairly insurgent. So it was a delight to see that everyone followed all of their instructions. I will ask my facilitators to introduce themselves and their question, and then perhaps give a précis of what they heard, and then we will terminate the session and move on to the rest. So I'm going to start with table number 1. And please use your microphone because this is being webcast.